Hello, I'm Dr. Rudy Kasha, and if you're watching this video, then you're considering or possibly coming in to see me for a rhinoplasty or a nose job. So we're going to talk about that, give you some information, hopefully help you along the process as you make a decision as to what's right for you. So rhinoplasty, really cool procedure. Little changes can make a big difference, and that makes it really cool. But it's also one of the more complicated and complex procedures that we perform. It's more unpredictable and has higher revision rates than a lot of the other things we do. So that's a very important part to know with a rhinoplasty. It's something on our face that obviously is right there in the field of vision, kind of locked in with the eyes, so we see it very easily. It's something where we see imperfections at a much closer rate really than anywhere else. So our ears can be like a centimeter off and we don't even notice it. Our cheekbones can be off, we don't notice it. But if the nose is just a millimeter or so deviated or has some sort of asymmetry, we see that. So that's important going into this, knowing that. That no surgery is perfect. I wish it was, but none is. So it's just kind of ups the ante on, we really need to get this right so that it gives you those results that you're hoping for. And that's important to really wrap your head around going into surgery, being aware of that. So is perfect going to happen? No. But we're going to shoot for real close to that. So that's kind of the idea. If there's some fine little mild things that are imperfect, that's usually something we have to deal with and live with in a rhinoplasty, because the risk of going back to fix that is even higher than the first time, and we could actually cause more problems. Obviously, if something really doesn't heal right or do right, then we want to go back in and take that risk, because it's worth it in that case, and we'll take you back and do everything we need to do to fix that. So those are some real life things you kind of have to think through yourself while considering this type of surgery. All in all, though, it's a great surgery. I'll kind of talk you through how it happens, and I'll show you during the consult some pictures and things so that it kind of makes a little bit more sense. But basically with a rhinoplasty, we're dealing with different functional aspects of the nose and aesthetic and structural aspects. So there's bone at the top, the nasal bones, and then there's two levels of cartilage, upper lateral cartilage and then lower lateral cartilage. For most people, and everybody's different, but the general concepts in a rhinoplasty is we're dealing with the dorsum, so the little hump in most people, and refining the tip. That's the typical scenario. There's all little modifications of that with different people, and that's something we'll specifically talk about. But with the procedure itself, done in one of our surgery centers, full team, nurses, scrub techs, myself, typically done under general anesthesia with a board-certified anesthesiologist. I first make a little incision through the columella right here, so that's the only visible part, which heals great. You'll see some pictures of that. And then the rest is on the inside of the nose, so you don't see it. We lift all that skin up, and then we're exposing the structural framework of the nose. First, we typically deal with the dorsum, so that's a dorsal hump. That's made of bone and cartilage. So sharply, we take that cartilage off and that bone off, and that reduces so that you have a nice slope to the nose. If you think of it this way, think of it like a triangle. And if you cut the top of the triangle off, you've reduced the height of that triangle and smoothed it out. But now what you're looking at, or someone else is looking at when they're looking at you, they see a wider part of the triangle. So that's the reason why we go back in and fracture that bone. So that's all under the surface, but that's breaking the nose down through here, kind of the typical part you hear about with a rhinoplasty. That collapses in the side walls of that triangle, now giving you the appropriate width of the nose. So that's all aimed at the dorsum, or this bridge, so to speak, part of the nose. Now with the tip, usually what's happening there, people have a rounder or a boxier tip. And that's usually caused by these lower alar cartilages being too wide and having too much of a curve, not sharp enough of a curve. So we go in there and take off part of that cartilage, that's called a cephalic trim, removing part of that cartilage to get the right width. And then we put sutures in appropriate locations that define what's called tip defining points that give you a nice triangular dome shape to the tip of the nose. So that's really shaping the tip and kind of formulating all of that. Then we close everything up and we put tape on your nose, a splint on your nose, and packing inside of your nose. With the risks that you want to know, and then we'll go into recovery. So risks, like we talked about, kind of the overall concept with it being a more complex surgery with more risks in that regard, but also just the fact that the cartilage itself is very finicky. It can warp or reabsorb or even disintegrate. That's kind of the thing that happened to Michael Jackson's nose. He couldn't stop, and he kept trying to do stuff and achieve a level of result or perfection that wasn't real, and his cartilage just disintegrated and went away. So that's kind of the extreme example of what can be a risk in a typical rhinoplasty, is that cartilage can, even months down the road, it can just start to curve over a little bit, or scar tissue can constrict it somewhat. You can also get bones that malposition. Think of them kind of like silver dollars on the beach. And you take those and you're breaking them and then kind of standing them next to each other and saying, please don't move. That's basically what's happening in a rhinoplasty. So the risk is a little bit up for that you could get malposition of that. That could be a cosmetic issue, or it could have a functional airflow issue from that standpoint. There's risk of significant bleeding. That's one of the reasons I like to do it under general anesthesia, because that protects your airway and everything like that, so we keep you nice and safe. But just those general things. You'll also get a big printout that'll have everything detailed out for you, so make sure you read through that so that you're fully informed as well. But afterwards, you'll spend some time in the recovery room, then you'll go home. You usually don't see me for about 5 or 6 days. I'll give you a call the next day to check in on you, but you don't have to come back for 5 or 6 days, because I'm just leaving it alone, not going to touch anything. And then at that 5 or 6 day mark, we'll take everything off, take the packing out. That's the part you're going to hate. You can't breathe, and it's going to make your throat sore. So that's the only rough part. It's usually not very painful, but that really annoys you. But all that will come off. The little tiny sutures that are right here will come out. We'll look at everything, and then we just put the external part back on for another 5 days. So nothing's on the inside. You'll feel a ton better at that point. So somewhere around 10 to 12 days of something on your nose, and then it's all off at that point. So like I said, not very painful, but don't bump it. You're gonna have a lot of restrictions for 6 weeks of not putting any pressure or anything you could do to bump the nose, because we wanna leave that all alone. Some people will probably take about a week off from work. If you don't care if people see in a splint, within several days you could go back. It's totally fine. But if you don't want them to see in a splint, that's gonna be roughly 10 days or so. But for most people, when that splint comes off, especially women, the nose looks pretty good. It's not nearly at its final result, but it's not something that stands out very much at that point. It's a little larger in general because it's still swollen, but the shape should look quite nice. But over those 6 weeks, you're going through the healing process and everything like that. And where we take our photos is usually about 4 months, so that kind of gives you an idea when you're pretty much done with any kind of swelling or that sort of thing. But it looks great even before that. So that's a rhinoplasty basically in a nutshell. Great procedure, but is something important to consider things before. It's one of those things you want to think through the risks and that sort of thing prior to proceeding, just so that you're fully informed and knowing, just because it is a high value place of your face. So very much on display. So hopefully that helps, and then I look forward to meeting you.